I think that is really impressive because they know that just surgery is just part of it, really. There's a lot of work you need to do beforehand, and there's an awful lot of work to do after the surgery. And so having people around that you can work with and trust and feel that can guide you through that recovery, I think is really important as well. I guess a sort of strange feeling because you wouldn't think you would be excited going in for major surgery, but I was in such intense pain and having such difficulty walking, doing stairs particularly. I just wanted to be free of that pain. And so the opportunity to have the hip replaced, and when that was done and I first stood on my hip, or had my hip supporting me, and that pain wasn't there, it was just such a relief. If it's the first time you've gone into a surgery, you don't really know what to expect, and I think when they come and take you from the waiting area where you've been beforehand, I guess I had a feeling that I was going straight to surgery. And then we stopped in a pre-op area, and I was there for quite a while, and so I didn't know why, and some patients would come in, some would leave, and I did start thinking, gee, has something gone wrong with the surgery before me, and now there's a hold-up, and if it's gone wrong with someone before me, could something go wrong with me? So you start these things going through your mind, I think. But when I went in second time, wasn't concerned about that at all. So I think it's just being a little pre-armed with knowledge and knowing what to expect.